We begin with the latest on the health situation in Iran, where state media says that one person is dying from Covid-19 every 7 minutes and that there have been 215 new coronavirus deaths during the course of the last 24 hours alone. Well, the combined death toll now stands at more than 17,400, but some experts are casting doubt on the accuracy of the data. And according to a BBC report, the actual number of deaths in Iran could be 3 times higher than what the health ministry in Tehran is reporting. However, Iranian officials are denying there's been any cover-up. Well, let's get more now from France 24's Sanam Shantyaei. Sanam, you've spoken to a doctor in Iran a little earlier on today. They asked for their identity to be concealed. What sort of a picture does he or she paint of the coronavirus situation in Iran right now?
I did speak to a doctor who works for a private health clinic, which is just 40 kilometers outside Tehran, the capital. And he said that based on his own experience and others in the medical profession that he's speaking to, the numbers could potentially be up to 3 times higher than what we're officially hearing. That's very much in line with the BBC report that you mentioned earlier. The doctor told me that on average, this clinic is receiving around 150 patients over 24 hours. 100 of those patients are showing coronavirus symptoms, but only one or even a handful of them are being tested. Why? One of the reasons is that there is a shortage of tests across the Islamic Republic. And secondly, unless you belong to what we refer to as a vulnerable group, so a pregnant woman, for instance, the state doesn't assume the costs, and the costs are extremely high. They go up to 450,000 toman, which is 17 euros. Doesn't sound like a great deal to you and I, but that certainly digs into the pocket of someone on a minimum wage salary in Iran, which for a month is under 100 euros. On top of this, there's no real official link between some of these outer city private clinics and the Ministry of Health. So the numbers are not being relayed. And lastly, while on paper, there are protocols, they're not being implemented. So we're talking about masks, social distancing, because they're not obligatory. People are not being fined. So if you happen to walk into a restaurant, a cafe, a bank, or even public transport, more likely than not, you will see a large number of people that aren't wearing masks or respecting social distancing. As a result of this doctor told me that we can expect a third powerful wave in autumn, and there's not a great deal that people can do about that because, of course, they can't afford not to go to work.
OK, and Sanam, how are authorities in Iran reacting to these reports of a cover-up of the true number of lives lost and infections there?
Before I delve into what the authorities are saying inside Iran, it's important to note that even with these potentially questionable figures that are being provided, Iran is the worst hit country in the Middle East. In 31 provinces, out of those, 26 are in the red zones. As you mentioned earlier, one person dying from Covid-19 every 7 minutes. Now, what are we hearing from officials? I spoke to a source very close to the country's leadership who said that the BBC report is inaccurate. It's, quote, fake news. It's propaganda against the Islamic Republic. Secondly, he claimed if these numbers provided by the officials are, in fact, inaccurate, then this would be the optimal opportunity for the conservatives in the country, for the principalists, those that are against the establishment of President Hassan Rouhani, to really attack him and lay into him, as they've done so previously with the breakdown of the nuclear deal, for example. Lastly, he said that the outbreak in Iran was actually announced just prior to the country's parliamentary election, which was in February. Why is this important? Because there happened to be, and it certainly contributed to the low voter turnout. And elections are extremely important in countries like Iran because the electoral procedure are able to add a layer of legitimacy to the country's rule. So this particular source bashing these claims by the BBC, saying that there is systemic cover-up. Now, whatever these claims are and whatever the reality on the ground, we can't deny that this is a very powerful second wave. And the reasons behind this are aplenty. I'll give you 3 of them. One of them is that because of the sanctions and what have you, the authorities decided not to shut down the economy because of mismanagement. It's an already battered economy. Secondly, something I alluded to earlier, the protocols aren't being implemented, wearing masks, social distancing. And last but not least, you have what we refer to as super spreader events like religious ceremonies or even weddings. They have not been banned. The situation is so bad inside the Islamic Republic, and this is very rare. Some officials are coming out to slam the way the country's been mismanaged. They're saying, we want less slogans and more action.
Okay, well, thank you very much indeed for that update. Sanam Shantyaei, thank you so much.